everyone. Welcome to Move Well, Live Well. We get a number of people that come in here who have issues regarding their ribs. In particular, what they're complaining of is pain in the ribs, sometimes ache, sometimes it can be sharp, and it just follows along, kind of where the sternum, the end of the xiphoid process, the end point of the sternum right here, and it follows these lower ribs all the way down like this, and even pain into the side, sometimes into the back a little bit. And what we're finding with these folks is we're finding a lot of knots and tightness in the external obliques, the rectus abdominis, and then even when they're taking deep breaths, they can feel a little sharpness in through here because of their diaphragm. They're experiencing knots, tightness, and trigger points in the diaphragm. Now, these are folks who, a lot of them have started either an exercise program or they've increased the intensity of their exercise program when it comes to abdominal work, or even they started a new sport, like, right now it's winter in Colorado, and they're skiing, and they're doing a lot of twisting, snowboarding, they're doing a lot of twisting, that type of thing. These folks have started a new activity, and they're getting activation of the abdominals, the diaphragm, and the external obliques, and they're starting to get knots in there, and it's causing pain into the ribs, especially right in through here, this kind of like lower rib area. And even if you push in here in the intercostals, the serratus, that type of thing, they'll have discomfort as well. Well, how do you fix that? How do you fix this pain and discomfort in these ribs and the rectus abdominis and the diaphragm and the external obliques? Well, you get your handy dandy yoga ball. This is like a Pilates ball. This is actually a soft, it's called a toning ball, physio ball. I think it's 4 pounds. Yeah, 4 pounds. And it's soft. You get one of these. You don't have to get one of these if you want. You can use a ball you have at home, maybe a basketball, that type of thing. But I find that these ones, they're about 4-5 inches in diameter, are the best. And what you do, here, let's tilt this down here for you so you can kind of see what I'm doing. So you sit like this, and what you do, you're going to lay right on, see your ribs right here. You can feel that rib edge, and you're going to put the ball in those areas where you're feeling discomfort and tightness. And you can put that ball, I'm kind of leaning to the side a little bit so you can kind of see what the ball's doing. And I'm just using the weight of my upper body. I'm just going to kind of come down on the ball, and right there, even for me, I feel a little tightness and tenderness in there. And what you do, you just search around for these tight areas. Like right there, there's a tight one for me, and kind of the external oblique a bit, and right there. And then I can just kind of oscillate back and forth on the ball in that area. I can even do a contract relax where I take a deep breath and then push my abdominal muscles against the ball and then relax. See that? You can almost see it I think in the film. And you sink more into the ball as you take those deep breaths in those areas. So work along that not knife edge, but that edge, those ridge. As you work in here, you can work these areas of tightness along the edge of the ribs, right in through there. And even up into the kind of the xiphoid process, you can get up in here too. You sit in here like this. Oh, right there. Oh, that's a good one. And get those rectus abdominis, if you have tightness in the rectus abdominis. Also, people that sit a lot, we sit down and we're in a kind of a crouched position. The rectus gets tightened through there. And then you could do a contract, like somebody's going to sock you in the stomach. What you do is you kind of tighten your abs, like someone's going to punch you in the stomach, getting bracing for it. You push into the ball like that, and then you can sink down into it. Work in these areas 3 to 5 minutes. Right there. Ooh, man, that's a good one. And I can oscillate back and forth in those spots. And there's, I'm going down the rectus here in the midline of the belly. And again, I can contract. Relax in through there. I'm moving my arm out of the way so you can see that blue ball there. Contract, relax in these areas. And I can oscillate back and forth. And man, there's a lot of, even in me, man, there's a lot of junk in here. I can really feel that. So work these guys out. And you'll see that you have a lot of tenor. Some of these people, you can be really tender. So work to your tolerance. You might not be able to put all your weight on here like this. You know, you may have to just kind of use your arms for support and keeping you propped up a little bit, and then ease into the pressure as you can tolerate. And so this will help loosen up those knots and trigger points in the rectus abdominis, external obliques, even up into the diaphragm, right in through there, to help alleviate that pain that these folks are feeling right in through here because of starting a new exercise program with increasing their abdominal work, or a new activity such as skiing and snowboarding, doing a lot of twisting, or sometimes they're out, doing those exercises using the sledgehammer up against the tire, and then they start getting a little bit of pain and discomfort in this rib area. So great tool to use. You don't have to use one of these, but I find these 5-inch diameter soft physio toning balls work really, really well to really get there. You can use a lacrosse ball as well. I just find that it just feels better with this size in this area. You can use a lacrosse ball too. It's just a little bit more pressure in through there. If you can tolerate it with the lacrosse ball, that's fine. Or even a bigger ball like a basketball. Sometimes if you're really, really tender in there, sometimes a bigger ball, that way your whole weight is not on there as much. You can be at a better angle and doing self-therapy in through here. So anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well and live well. Also, I know you know folks who are battling, this weird kind of lower rib pain and discomfort. And they may have started a new exercise program or a new activity that involves a lot of trunk rotation or trunk flexion. Share this with them. They may be exhibiting knots and trigger points in the obliques, the abdominals, and the diaphragm. And it's not good to see your friends and family suffer. So sharing is caring. Also, give us a thumbs up. Give us a like. It lets us know you care. Thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.